folks, those are our candidates. We've looked at them all. We've talked about them all. Let's start talking about these issues that are particularly important to the community. So let's start with the one that we kept having to pause and say, okay, we'll talk about this in a minute. We'll talk about this in a minute. Mental health. Shannon, I'm going to let you kick this one off because you've got the most experience in this issue.
I just think so mental health is a huge issue. It needs to be addressed as I had mentioned earlier. We need trained individuals like mental health counselors, social workers who can um work with teach police officers how to deal with those situations so they don't get escalated to where they're slamming someone on the floor, or those situations get escalated very easily. So, as I said earlier, Steve Flores has talked a lot about his stance on mental health. We talked about the autism program that
Yeah,
he
tell us a little bit more about Blue Envelope. I read a little bit, but I wanted your thoughts on that.
So, so what it is it's an envelope and it has things that would be needed. Like when a police officer pulls you over, they ask for license and registration. The information is already in there
So they don't
because
have to verbalize it.
right, or yes, and it explains, that and it doesn't just have to be someone on the spectrum. There could be
Yes.
other with communication
Anxiety
issues.
disorders,
Yes, yes, and
disorders. Yes, yes,
right.
yes.
And it explains, that this person may be acting differently because they have this diagnosis, or, like, please be patient with them. Let them take their time in explaining, or, getting you the documents and things like that. It's very important. And it's sad that St. John is only the second township in the state that has this program, which is very sad. So, um, I think we need someone who cares and wants to address mental health. And I think Steve Flores has been very vocal about that. I also felt Edward Jenkins, he also has addressed that
Mhm.
issue quite a bit. But bottom line, I think we need someone who's going to work with mental health professionals to incorporate into the police departments.
But you said that you had had some interactions with some candidates where you didn't care for their stance on mental health.
Yeah, it was just one, and
Okay.
I just felt like she just kinda blew it off. I had asked if, there were situations, do you think it would be helpful to have a mental health worker there with the police to help in those situations, like when they get a call? And she's like, "No, we don't need more people at the scene." And I was just like,
All right.
"Okay."
This is one where I'm going to also put my thumb in. In case you don't know, I'm sure you probably do by now. Both of my children are on the spectrum. I've had law enforcement have to come out and interact with my family in ways where, if they weren't, trained to deal with mental health, it could have been a fiasco. And that's one of
Right.
my terrors. Um, that that something's going to happen, and somebody's in the throe of a mental health crisis. It can go south so quickly. You
Absolutely.
It
absolutely,
can.
to me, this is the most important issue for me personally in
Yes.
my choice of a sheriff's candidate. And if a candidate isn't taking that seriously, uh-uh, absolutely not. All right, as you were.
So Tracy, I have a number of
Yeah.
questions because I think it's like I am like time out for the performative, like this is the answer. This is I'm raising this, but I don't have a plan to deal with it, right? I'll say like miss me with like saying all the correct trigger phrases that get people to vote for you, but like what is the real plan to execute on this once you're elected to office? And so while we are still in election mode, there are some questions that I have for some of these candidates, right? Like there's a lack of data around, how mental health shows up at Lake County Jail, right? What percentage of the
Hmm.
jail population has been diagnosed with a mental health condition? How quickly are they screened and stabilized at intake? Does the candidate have a plan to reduce the number of people in jail solely because they have mental health crises? Like, what is that plan, right? Whether you said it during your election campaign or not, when you're there, you're going to have to deal with it. That's the reality, right?
Mm.
because I do a lot of corporate accountability and follow money, is there's lawsuits, there's litigation, there's all of the taxpayers are faced with when the jail doesn't do a good job, right? Lawsuits tied to suicide, withdrawal, lack of health care access because of mental health related reasons, right? And then like, how are we measuring success or whatever we do? Like, what are the indicators that we've done a good job or a better job at the end of year one, and how do we fix that? And so I have not heard any of the candidates really talk about this in depth and be able to answer that question, talk about how they're going to provide data around it. It's like all the warm and fuzzy stuff that gets people to vote. And like I said, time out for me, miss me with all of that. I want to see a plan that's going to yield tangible results that are measurable and quantifiable. And so that would be my question. And if you see me at a forum over the next couple of weeks between now and May 6th, those are the questions I'm going to be asking these folks about mental health, because it is really about how are we lowering our legal exposure, how are we reducing some of the stress on officers around overcrowding at the jail, stabilizing staff, thinking about how we reducing costs, and how this leads to really improving public safety if we have a real plan around it. Right. And so like the kids say, no, just talk about it, be about it. That's what I really want to see happen. And I think like the folks who are on this podcast today are going to be a part of holding whoever wins accountable on those promises or their commitments on mental health once they're elected. So yay for us.
Yeah.
There's a lot of time between now and May 6th. So maybe the candidates here will accept your challenge.
Renee, I had a question because of the type of work that you do. I'm wondering how much somebody could make a very concrete plan for a job that they don't really know, like how many people are there. Do they have the stats available to even look for that? That would be my only question.
They have stats on jail population and census. I don't know if they have the data that de-aggregates like some of these questions that I'm asking. They should be asking those questions for either the person who's being detained or the family member. Do they have mental health? Are they on medication? Do they have some addiction or substance abuse problems? My son is a former correction officer at the Indiana State Prison. My grandson is a current Gary police officer. So
God
yeah.
bless them.
So
I didn't even
so
know
like
this
so
when I
like
invited Renee on. I
understanding these
told y'all I
things
found the right people.
asking the right questions is just a part of collecting the data and making it easier for them to manage and address the issues that are prevalent in the jail population, right? But if you're not asking the right questions, you're not going to get the right outcomes.
Shannon,
there there was one thing I did want to add with Maria. Yes, when I did ask her about the situation about having the mental health worker with the police, and she kind of shot that down. I will say though, she did mention at one of the million things I saw her speak at, she did say that one thing she did want to do is have like mandatory sessions for all police officers to talk with she wants a mental health professional on staff for the police officers because she feels like nobody has had that resource. And she said not for just ones who she feels is going through something, but for everybody, that they would have to talk to a mental health worker because she said oftentimes they're not going to say they need help or they are struggling. So she did address that.
A lot of stress. They see a lot of things. And they do this, every day. And so making sure that they have some mental health resources so that they're not perpetrators of domestic violence, that they're bringing their best selves to their jobs every day is really important. And I hope the other candidates and whoever is elected takes that into consideration as a part of their platform. That would be amazing.
Right, I agree.
If you go out in Lake County and you look for a therapist, which I did, I found therapists that actually state that their specialty is firemen, policemen, PTSD, that kind of thing. So it's needed. But do their departments pay for that, or do they just do that if something
They
happens?
should.
Right. And I will say with Maria, she had mentioned that yes, that would be the department who provided that.
Right, right.
Okay, so I know that, it seems like there's a lack of a very definitive plan. But based on what we want to see in mental health in Lake County from our in the sheriff's department, both from towards the community and towards the officers that serve, do you guys have feelings about which of the candidates might have be able to best execute on that?
I mean, Flores, because he's already done it.
That's exactly what I was going to say. And on his platform, he says he wants to strengthen partnerships with mental health professionals, establish crisis response teams, support diversion programs over incarceration when appropriate. He has that laid out in his platform.
That's no small thing if
Right.
only 2 townships in the state have it.
Right.
Jenkins seemed to have a focus on this as well. Renee, what do you think about
He
his
did.
idea?
Yeah, I think both Jason and Jenkins have both kind of indicated that mental health would be something that be a priority. I don't think they've been as explicit in laying
Yeah.
out the real platform the way
Mhm.
Flores has. So it'll be interesting to see if one of them emerge out of this as the sheriff, how they execute or how they plan on executing that.